Okay, now we're going to talk about eye trauma. This is on page 1071 in Iggy book. The first one we're going to talk about is hyphema, and this is a hemorrhage in the anterior chamber occurring when a force is applied to the eye and it breaks the blood vessels. If the hyphema is large, it may block the pupil and reduce vision, possibly causing pain and some photophobia. So we may have pain, we may definitely have blood in the anterior chamber, and you can also have increased interocular pressure. Usually the management consists of having the patient in semifallopian position for bed rest, and that aids in the gravity to keep the hyphema away from the optical center of the cornea. Minimum or no sudden eye movement permitted for 3 to 5 days to decrease the risk of rebleeding, and they can give the cycloplegic type of medications, paralyzing eye drops may be prescribed. The eye is usually patched and shielded. Television reading is restricted, and it usually resolves within 5 to 7 days. Okay, now we'll talk about a contusion. A contusion of the eyeball and surrounding tissue is caused by traumatic contact with a blunt object, and the force of the blow pushes the eye back into the socket itself. Periorbital ecchymosis or black eye is a common contusion injury, and it's usually caused by a fist right into the eye. Bleeding into the soft tissue occurs, creating the bruising. The color gradually fades and disappears in 10 to 14 days, and usually visual acuity is not affected, although they may have orbital pain, photophobia, eyelid edema, and diplopia may be present. And the treatment for this is ice, and to make sure that the patient has a thorough eye exam to rule out any other eye injuries. The next one we'll go over is foreign bodies. Foreign bodies, you can have eyelashes, dust, fingernails, dirt, airborne particles, anything that comes in contact with the conjunctiva or the cornea and that can irritate or abrade the surface. Usually if nothing is seen on the cornea or the conjunctiva of the eyelid, then is everted to examine the conjunctiva. The patient will come in with severe pain, lacrimation, foreign body sensation of the eye, photophobia, redness, and swelling. This is a medical emergency because we need to remove whatever it is in the eye, that foreign particle, through irrigation or a cotton-tipped applicator or through a magnet. The treatment of intraocular foreign body depends on the size, the magnetic properties, the tissue reaction, and the location, and it is a surgical removal. Usually an eye patch is applied after the foreign body is removed, and follow up with the ophthalmologist as needed. Okay, lacerations are wounds caused by sharp objects and projectiles, and initially you should have the patient close the eye and apply a small ice pack to decrease the bleeding. The patient should have medical attention as soon as possible. If the patient can open the eye, check the visual acuity and clean the eyelids. Corneal lacerations are an emergency because eye contents may prolapse through the laceration itself. Manifestations include severe eye pain, photophobia, tearing, decreased visual acuity, and inability to open the eyelid. The object is removed only by the ophthalmologist because it may be holding eye structures in place. Antibiotics are given, especially if they've had any kind of wood laceration, because it can cause infection. And if the eye contents have prolapsed because of the laceration, or if the injury is really severe, they may have to remove the eye. Under penetrating injuries, patients that have this have usually the poorest chance of retaining vision in the injured eye. You can have glass, high-speed metal, or wood particles. BB bullets. Bullets are real common causes of penetrating injuries. The particles can enter the eye and lodge in or behind the eyeball. And the patient usually has pain and reports, I suddenly felt something hit my eye. You may even see an entrance wound depending on where the object enters and rests within the eye, and vision may be affected. They usually do an X-ray and a CT scan of the orbits. MRI is contraindicated because of the procedure may move any kind of metal within the eye and cause more injury. Surgery is needed to remove the foreign object. Make sure that you assess and document visual acuity. Anytime you have any kind of trauma with the eye, you always want to check visual acuity, or any problem with the eye. If the patient comes in and even has a horgillum or a stye, or has any kind of redness, you want to make sure that you check visual acuity. Okay, I think that does it for eye disorders. If you have any questions, make sure that you text me or email me, or you'll see me on Wednesday. Okay, now we're going to talk about eye trauma. This is on page 1071 in Iggy book. The first one we're going to talk about is hyphema, and this is a hemorrhage in the anterior chamber occurring when a force is applied to the eye and it breaks the blood vessels. If the hyphema is large, it may block the pupil and reduce vision, possibly causing pain and some photophobia. So we may have pain, we may definitely have blood in the anterior chamber, and you can also have increased interocular pressure. Usually the management consists of having the patient in semi-Fowler's position for bed rest, and that aids in the gravity to keep the hyphema away from the optical center of the cornea. Minimum or no sudden eye movement permitted for 3 to 5 days to decrease the risk of rebleeding, and they can give the cycloplegic type of medications, paralyzing eye drops may be prescribed. The eye is usually patched and shielded. Television reading is restricted, and it usually resolves within 5 to 7 days. Okay, now we'll talk about a contusion. A contusion of the eyeball and surrounding tissue is caused by traumatic contact with a blunt object, and the force of the blow pushes the eye back into the socket itself. Periorbital ecchymosis or black eye is a common contusion injury, and it's usually caused by a fist right into the eye. Bleeding into the soft tissue occurs, creating the bruising. The color gradually fades and disappears in 10 to 14 days, and usually visual acuity is not affected, or although they may have orbital pain, photophobia, eyelid edema, and diplopia may be present. And the treatment for this is ice, and to make sure that the patient has a thorough eye exam to rule out any other eye injuries. The next one we'll go over is foreign bodies. Foreign bodies, you can have eyelashes, dust, fingernails, dirt, airborne particles, anything that comes in contact with the conjunctiva or the cornea and that can irritate or abrade the surface. Usually if nothing is seen on the cornea or the conjunctiva of the eyelid, then is everted to examine the conjunctiva. The patient will come in with severe pain, lacrimation, foreign body sensation of the eye, photophobia, redness, and swelling. This is a medical emergency because we need to remove whatever it is in the eye, that foreign particle, through irrigation or a cotton-tipped applicator or through a magnet. The treatment of intraocular foreign body depends on the size, the magnetic properties, the tissue reaction, and the location, and it is a surgical removal. Usually an eye patch is applied after the foreign body is removed, and follow up with the ophthalmologist as needed. Okay, lacerations are wounds caused by sharp objects and projectiles, and initially you should have the patient close the eye and apply a small ice pack to decrease the bleeding. Patient should have medical attention as soon as possible. If the patient can open the eye, check the visual acuity and clean the eyelids. Corneal lacerations are an emergency because eye contents may prolapse through the laceration itself. Manifestations include severe eye pain, photophobia, tearing, decreased visual acuity, and inability to open the eyelid. The object is removed only by the ophthalmologist because it may be holding eye structures in place. Antibiotics are given, especially if they've had any kind of wood laceration, because it can cause infection. And if the eye contents have prolapsed because of the laceration, or if the injury is really severe, they may have to remove the eye. Under penetrating injuries, patients that have this have usually the poorest chance of retaining vision in the injured eye. You can have glass, high-speed metal, or wood particles. BB bullets are real common causes of penetrating injuries. The particles can enter the eye and lodge in or behind the eyeball. And the patient usually has pain and reports, "I suddenly felt something hit my eye." You may even see an entrance wound depending on where the object enters and rests within the eye, and vision may be affected. They usually do an X-ray and a CT scan of the orbits. MRI is contraindicated because of the procedure may move any kind of metal within the eye and cause more injury. Surgery is needed to remove the foreign object. Make sure that you assess and document visual acuity. Anytime you have any kind of trauma with the eye, you always want to check visual acuity, or any problem with the eye. If the patient comes in and even has a horgillum or a stye, or has any kind of redness, you want to make sure that you check visual acuity. Okay, I think that does it for eye disorders. If you have any questions, make sure that you text me or email me, or you'll see me on Wednesday.